Hi everyone, I'm Alex. I'm a nurse practitioner. I work here with Dr. Young in Florida. And today I'm going to answer some questions about thyroid. So a lot of people ask this question, is my thyroid okay? I don't know, I got it tested, my doctor tested and they said it's fine, but I don't feel fine. I feel super tired, I have a lot of hair loss, I've been on the same medication for the past 5 or 10 or 20 years, nothing has changed. I think it's fine. What do you think? I read something on the internet that says that I need to test my levels in a little bit different way or take a different medication. What do you think? So my view of a thyroid, a condition is this. One, we test your thyroid with a whole panel of thyroid hormones. Your primary doctor will probably order a TSH level for you, and that's fine. But we like to go a little bit more in detail and know exactly all your T's. Know your T4, know your T3. We like to know your reverse T3. Why? Because sometimes what happens is some people, let's say you take Synthroid and your TSH is fine. And then when we order a whole panel, next thing we know, you have a good T4 because that's what Synthroid is. You get a great T4 level, but your T3 is low. What does that mean? That means that your body is not converting properly. You're not getting a T4 to T3 conversion, and it's not good enough for you. Therefore, you don't feel good. Now your hair is falling out. So we like to test in more details. Also, people ask me, well, Alex, do you only use Synthroid? Do you only use Thyroid? Do you? No. We are very open-minded. We use things for different purpose, for different things. A lot of times I do need to use a T4 if people have certain genetic enzymes, certain genetic mutations, then I need to add a T4 depending on what I'm dealing with. But we can use pig thyroid, we can use Synthroid levothyroxine. There's different ones on the market depending on the patient. So what I find is that it's not so much the type of the medication, but also how you dose the medication and also what kind of conversion do you have. So if I am gonna give you a dose based on your TSH, a lot of times I'm gonna miss the mark. I'm gonna make you, take a low dose and you're still gonna feel tired. So I do have to look at all your T's, all your T3s and T4s. So the dose is really pretty important when it comes to that. But also there are Hashimoto's thyroiditis, which is inflammation of the thyroid, what we call Hashimoto's. That could be one of the causes why we keep trying to adjust your medication and we can't get it right. So because that could be a problem, we also have to look at your immune system. So how's your vitamin D levels? If your vitamin D is super low, your immune system is gonna be, out of balance, and you can start having an autoimmune condition, which means your body is attacking your own thyroid and now you're producing less hormones. So I need to look at that. I need to know if you have or you don't have Hashimoto's. From our point of view, it's important to address the immune system, which means I might have to give you vitamin D, or you might have a gut problem. You might have some stomach issues that I have to address. So it's very important to have a good gut function so you can have a good thyroid function. So sometimes it's addressing the gut can improve you, addressing your diet can improve your gut. So we have to know what you're eating, maybe what kind of food sensitivities you have. So there's so many things that we can think about in order to optimize your body to get your thyroid to function properly. It's not, for us, from our point of view, it's not as easy as just write you a prescription for thyroid. We're looking at so many things to get your thyroid to work properly. I'll give you an example. I just saw a patient today. She's been taking Synthroid for the past 2 or 3 years with super low T3 levels and a normal TSH. There's a name for that. They call the low T3 syndrome. It's just because her conversion is terrible. She was taking 137 micrograms of Synthroid, and even though it sounds like a high dose, her conversion was not great at all. So those are the things that I'm looking at in order to optimize your thyroid. So that can affect even your blood pressure. That's one of the things that this patient actually had, even though she was taking Synthroid and her T4 levels were fine. Because her T3 was so low, there were a bunch of other things going on. Her blood pressure was a little bit in the high end of the spectrum. Her digestion wasn't quite right. But her main complaint was because she was so tired. That's why she came in. So once we start having a conversation with the patient, then we can address the thyroid in a better way. So we do give you enough time to sit down and talk about all of those things. And so that's my take on the thyroid. It's different. It's different for everybody. Not everybody gets the same treatment, and that's why we call individualized medicine, and this is why we call functional medicine. But that's to answer your question about the thyroid.